Good evening. Today we will be discussing how to take history of a patient presenting with delirium, but the history would be collateral since patients in delirium usually have acute confusion at the time of presentation. Like all stations in this station, the first thing would be again introduction. Introduce yourself to the family member. Here we have the example of son. Um, you can introduce yourself as hi, I'm, or hello, or good evening, or good morning, or however you prefer. I'm Dr. Fayaz, one of the doctors in the emergency department or in the emerge in short. May I confirm you are Mr. Thompson's son? Um, in this case, since patient has delirium, they may not be able to answer properly. That's why we need collateral history from family member or someone who brought them in. That's why we are talking straight to the patient's family members, since patient may be in acute confusion. Once they answer yes, I'm Michael Thompson, or they confirm, you thank them and then introduce or let them know what you are there to do. So in this case, thank you, Michael. I would like to ask you some questions about your father's current condition to help us understand what's going on. Is that okay? Now, with this sentence, you're introducing the role that you're going to be playing and getting consent from the family member to talk about their loved one's health condition. They would say, yes, please go ahead, or they will say, sure. Any way that they verbalize it, you just get your consent and you can go ahead and start questioning. Now, for delirium, delirium is acute, usually hours to days of a change that happens, it manifests. Um, so that's why we are confirming that patients' confusion is acute and not their baseline confusion, since elderly patients who have delirium may also have baseline confusion due to dementia or Alzheimer's disease. You can ask them directly, when did you notice your father's confusion, or you can ask them, when did you notice worsening of his baseline confusion if they have confusion at baseline. In case of delirium, they will give you a very short time period, usually same day or the night before, something like that. In this case, we have here that it started this morning. He seemed disoriented and was saying odd things. Now, with another thing that with delirium is that it's very sudden. The confusion suddenly starts, and it doesn't get start like minimally and then get worse or gradually. No, it's very sudden. Like you would notice it almost immediately when it starts. That's why you have to ask, or you can ask them, was it suddenly, or did it start suddenly, or it got gradually worse? They would say, yeah, it was very sudden, or they would say, very sudden, he was fine last night. So now, if he was fine last night, this means it's acute confusion. Acute confusion is most likely to be delirium. Once you confirm, once you have done your introduction, confirm the onset and course, which was sudden onset and onset was this morning and course has been very sudden, and he has been fine before that. Now ask about baseline mental status. Like I said previously, some patients with dementia usually are confused at baseline. Uh, that's why you have to confirm their baseline mental status. You can ask them in simpler terms, which is, what's his mental status usually like? Is he confused on the regular, or is this something new, or does he have any problems of memory or dementia? Now, once you ask this question, patient's family member, they would usually give you a short answer like, no, he's usually very good. No, his memory is normal. No, he is quite sharp with memory and he's very independent, etc. Once you have done that, you can ask him about the same episode happening in the past. Has he ever acted like this before? Now, this will give us an idea of whether patient had an episode of delirium in the past, or any other strange behaviors in the past. Once you have asked about the course or how, if he has ever had that, you can move on to ask about symptoms of delirium. Now, with delirium, you would see that the patient is agitated, he's sleepy or drowsy. Um, they may get their confusion or their irritability gets worse towards the evening, and usually they get better in the morning. Now, how you verbalize it, you can use these sentences. Has he been more sleepy or agitated than usual? They will say, yes, he has been drowsy or agitated, yes, or no, he has been fine, but he is more irritated than normal. Uh, Next thing you need to ask about is concentration or focus. How is their focus? Has he had trouble focusing, like being easily distracted or jumping from topic to topic? They may say yes, definitely, or they may deny it. Now, finally, ask about times of the day when the confusion is worse. When is the confusion the worst, or is the confusion worse at certain times of the day? With delirium, we may see the confusion getting worse at night, and they may appear to be very normal during the day. Now, once you have covered symptoms, move on to factors that may precipitate it. Illnesses, infections, falls, injuries, new medications, drugs, alcohol, etc. How you do it, you can start with the more polite ones like illness or infections. You can ask them, any recent infections? Did he have any bladder issues recently, or any cough or fever? You can ask based on symptom like cough, if you think they may have a chest infection, or urinary issues if you think a bladder infection or UTI could be the cause of confusion in the patient. Uh, they will let you know if there are any symptoms. For example, here we have, yes, he had a fever last night and was urinating more often. Now, this gives us an idea that patient probably has a UTI, and a febrile UTI, which is causing his confusion. Um, you can then stop there, or you can continue with the questioning about the risk factors. Any recent falls, head injury, or pain, because in this case, if there is a history of infection, we know that the cause may be the infection for the delirium, but you can still question about other things. Falls is important, especially in the elderly, because sometimes they fall and they don't follow up, and they don't see anyone, and then it turns out that they have had an intracranial bleed or something serious going on. So ask about falls, head injury, pain, no falls. He complained of lower abdominal discomfort yesterday. Um, Ask about changes in medication. Some medications like anticholinergics or benzodiazepines, they can increase the risk of patient getting a delirium episode. Um, any recent medication changes or new drugs started? This is how you can state it, or you can ask them, has there been any recent change to their medications? They would say yes or no. In this case, yes, his family's doctor started him on oxybutynin for urinary urgency last week. Now, you can ask them about alcohol and recreational drugs. You can ask in one sentence, or you can ask separately. Has he taken any alcohol or recreational drugs? Or you can say, did he recently drink a lot of alcohol, or did he take a lot of alcohol recently? Or you can say, did he take any alcohol recently? They may say yes or no. And then you can say, any recent use of recreational drugs? They would say yes or no. Now, once you have done that, come to functional status on regular basis. Does he usually take care of himself at home? Yes or no? This will give us an idea to differentiate the delirium from dementia. In delirium, a patient from baseline usually is able to take care of themselves. Now, once you have done that, you can ask about medications too. Do you know what medication he's taking? They would say yes, no, hydrochlorothiazide, aspirin, the new oxybutynin, etc. Now, ask about red flags. Now, these red flags are very important to ask in real exam. Make sure you do not miss these. Um, Hallucination or paranoia, injury to or risk to self or others, nutrition. Now, these three are red flags. If they have any issues in these three, they may need to be admitted to the hospital and treated more aggressively. Like if they have any hallucinations or paranoia, they can act on that hallucination, or they can do something that they normally would not do due to paranoia. Um, if they has tried to kill themselves in the past or hurt themselves in the past or anyone else, they may repeat it. Or if they think of or they have planned to kill someone or themselves, they can actually act on it during the confusion. um, Drinking and eating is important because patients with delirium or dementia, they usually do not eat properly and they can go into hypoglycemia or other complications that may be hard to recognize with all this going on. Now, once you have all this information, uh, you are pinpointed towards delirium. What would you do next is to ask the family if they are concerned about anything. Um, you can ask it, what concerns you the most right now, or what is the most concerning thing right now? What are you worried most about right now? However you prefer to word it, you can word it, and then they would let you know what they are concerned about. In this case, the family member says that it might be something serious or a stroke, because we have never seen him like this. You can then reassure them. Thank you for stating your concerns. I understand why you would be concerned, something like that, to reassure them, and then we will work quickly to find out what's going on and help him better. This way you are reassuring them and acknowledging their concern. Now, once you're done with the family member, if they if you want to do a summary for the patient, you can do a summary, simple summary based on the information I have. Your father started to get confused since this morning, and it started all of a sudden. He was fine last night. He has had no he thought someone was in his room, and all those symptoms that you can repeat it back to him and then ask him, is that right? They would say yes, and you can ask him, am I missing something? This question is very important to ask. Sometimes we may forget to ask a question. If you say, if am I missing something, they uh, especially for exam purposes, if there is something, they may say it to you, or they may say no, that's all I have. Once you do that, summary for examiner, you can do a quick summary, but remember, for examiner you would use mostly medical terms. For patient, you would use layman terms. Summary for the examiner would sound something like, this is a case of acute confusion in a previously independent 78-year-old male, likely due to delirium, possibly secondary to a UTI, fever, urinary frequency, new oxybutynine, or anticholinergic toxicity. There is no history of dementia, trauma, substance use, or prior psychiatric illnesses. He's at risk for dehydration, worsening sensorium, and poor oral intake. All right. So in delirium, family member would ask you questions. Some of the common questions are, what is happening to my father? You can explain to them shortly what's going on. He's experiencing something called delirium, a sudden change in brain function that often causes confusion and hallucination. They usually are worried about this being a permanent thing. So they may ask, is this permanent, or will he recover, or how quickly he will recover? You can reassure them, since delirium in most cases is reversible and temporary. Once we start treating the underlying cause, patient's cognition returns quickly to baseline. They may be worried about stroke or dementia. You have to acknowledge their concern. That's a valid concern. I would be concerned too. I understand why you would be concerned. Anything to acknowledge their concern. We will rule it out, and then then give them a short reassurance. Give them hope, realistic hope. Sudden onset fluctuation. This means that it is delirium rather than dementia getting worse, or anything else. Now, sometimes they may ask you what causes it. If you have a working plan and you know what could be the cause, you can say it may be due to an infection like a UTI or a side effect from a new medication. We will run some tests to find out. If you don't know the cause, you can just say, um, it's a good question. I am unsure what may have caused it right now, but we will figure out what's causing his acute confusion and we will treat it appropriately. Now, they may ask about what's going to happen next, and you can reassure them that with proper treatment, patient from delirium, they recover very quickly in most cases. All right, I hope that made it any simpler.